Good evening, everybody, and welcome to our Smilefy webinar. Today, we are very excited to talk to you about how to create multiple 3D walk-ups in minutes using Smilefy. We know how important it is to involve our patients in the whole process of the treatment. So in this webinar, I want to show you a case where I spoke to a patient that wanted to do just some improvements on the laterals and centrals, but with my knowledge, I was able to show her with this visual communication and this feeling of having a new smile through a smile simulation and through a 3D walk-up. For those who don't know me, I'm Dr. Diogo Alves. I'm the Director of Clinical Education here at Smilefy. I'm based in Brazil. And I've been working with the company for about 2.5 years, almost 3 years. To me, it's been a pleasure as I've been applying everything that I know from my clinical workflow into this software. And that has helped thousands of doctors all over the world and has helped us to develop better workflows for you guys. The software was created by Ralph George, and his mindset was to make your workflow easier, simpler, faster, so you can have more predictable final results onto your restorations. Today in the chat, we have Dr. Samia. She is here to help you with anything that you need, anything that you ask. So please, if you have any questions, just talk to her on the chat. We also have Dr. Daniela. She's also here in the chat to help you with all the questions that you might have. The webinar today is based on a software called Smilefy. So for those who haven't tried Smilefy yet or haven't heard of Smilefy, I'm going to show you how you can do a whole workflow using the software with your iPhone, with your iPad, or with your MacBook. Just 1 second. So we're going to go over a workflow that goes from a first appointment and what you need to do in that first appointment to then do this intersection appointment. Let's say like that. It's when you 3D plan multiple mock-ups to 3D print, to then call your patient on a second visit to perform the smile trials. And if you have time, to initiate the treatment from that second visit on. So we know that creating an entire workflow for our office sometimes can be a little complex, especially if you are trying to implement a whole digital workflow in your practice, but you don't have your dental assistant with you, you don't have your dental hygienist with you, or you don't have a dental technician that is really up to everything that is happening in your practice. So the workflow that I will show you is a workflow that you can manage by yourself, and you can also teach others around your office to help you with a better workflow to you and to your patient. So on the first workflow, as you can see here, we talk about smile simulation, clinical findings, and digital records. When we talk about smile simulation, as the name says, it simulates the patient's smile. So rather telling your patients about a treatment plan just by saying words or showing some images on Google, you can use your patient's photograph to then explain the patient, chair side, what is the treatment plan that you are drafting or what you're looking for in a treatment that you will be proposing in the future. Based off of that, then collecting your patient's clinical findings and collecting your patient's digital records, you will then calibrate all these files into the software that will allow you to create these facially driven dental walk-ups. On a second visit, and I will show you guys, I'll give you some tips on how you can perfect your dental mock-ups, just how you can see here on the right side of your screen. You'll be able to perform 2, 3, 4 different walk-ups with a matter of, like, I would say, like a 30 minutes consultation, and have the patient to decide what is the best treatment plan that they feel comfortable with. We know that in most times our treatment plans are irreversible, even if we are prepping just the enamel, let's say, but it is reversible. So by giving the patient a chance to try on different smiles first, we'll give them the security of and the sense of doing the right thing and going to the right dentist. So let's go step by step. The first appointment. The first appointment, it's always very important for you to catch the patient's attention and to make them feel that they are in the right place. In the first appointment, what we want you guys to do is to, instead of just having a regular experience on that first consultation, we want you to the patient to have the best experience as possible. How? The first thing that you do is that by listening to your patient's desires, you can create a smile simulation powered by the artificial intelligence using the Smilefy iPhone version. So when your patient come in this case, for example, the patient was telling me that she needed to fix her two laterals. By looking at her, I could see with my clinical eyes that we could improve even more. When the patient smiled, I noticed that the patient had a gummy smile and also a high lip line. So I suggested her to do a smile simulation. She asked me what my simulation was. I simply told her that with just a picture, I would be able to draft a couple of different smiles so she could help me deciding which smile would be the best for her. That already changed the way the patient looked at me and at my office, because I was looking at her desires and showing her new possibilities even before initiating that treatment. So once I opened the Smilefy app on my iPhone, I took the frontal picture of my patient. The frontal picture of your patient, it must be taken in the right way, meaning the eyes of the patient needs to be looking straight at the lens of the camera. You have to have the patient's full face, and the patient needs to be giving you a big wide smile. If you look at the video that you're seeing right in the camera, Smilefy has a facial frame that automatically calculates the best photo for your smile designs. It's called the AI picture capture. So once you place the patient's face over that frame in Smilefy, Smilefy will start to take a couple of pictures, and then it will select the best picture for your smile designs. Now, let's talk a little bit about the smile designs. It's the picture taking itself. If you take a look at these 3 pictures, we have 3 facial pictures. However, on the left side, we have the right picture. On the right side, we have the wrong pictures. Why? The one on the left side shows you a patient in a natural head position. That is crucial for you to identify the patient's smile curvature and the proper proportions of the patient's existing teeth. I also noticed that the patient is looking straight at the lens of the camera and the face is not tilted to any side, which gives you an ideal position of the arch in comparison with the new design that you will be creating. Looking on the right side, you will see a picture that is tilted down and a picture that the patient has the face tilted up? What are the problems that we face here? If you take a picture like that, you most likely have a wrong smile curvature, wrong teeth proportions, and wrong teeth position in that picture, which will give you the wrong information for you to send to your dental technicians. So whether using a Smilefy or not, make sure that when you create a documentation for your patient, it is imperative that you take the right picture so that your treatment plan can be as accurate as possible. The picture here right in the middle represents that picture that you take of the patient when the patient is sitting on a dental chair, and I see this quite often. The patient is sitting on the dental chair, somewhat like in a 45 angle, and the doctor comes in and tries to take a picture of the patient's face. You will have the wrong information by taking these type of pictures. So to reduce these errors, Smilefy gives you the chance to take the proper picture by having the AI picture capture. Then right after taking the picture, you go ahead and perform that smile simulation right on the first consultation. So I'm going to share my screen with you right now of my Smilefy iPhone. So this is something that you can do in your practice. As I said it before, if you are a Smilefy member, you already know the workflow. If you're not a Smilefy member, you can simply download the software in the App Store, either on your iPhone or iPad or MacBook. But the workflow is pretty simple. I'm going to upload my patient's picture. So here, by having the patient's picture in my phone, I can use what we call a smile outline or smile frame, and I can adjust the smile curvature, adjust its height and proportions from a frontal view. And just by creating this smile simulation, I am already able to show my patient another possibility. As I said in the beginning, the patient came in just to fix those two laterals as she thinks it's too short. But by looking at the patient's premolars and canines and even the laterals, I noticed that the patient has a lot of gingival exposure. So I told her that we could improve her smile not only by doing those laterals, but to improve the entire smile by doing a small plastic surgery on her gums and increasing the length of her existing teeth. This is the power of a smile simulation. It's that instead of communicating with your patient with just words, you will show it to your patient different possibilities with a picture and an iPhone. So here, of course, as I'm saying from the beginning, this is just a simulation. I still need to perform my perio analysis. I still need to take a CT scan if I need to do an osteotomy, for example. But as a draft to my patient's future smile, These already exemplify drafts a lot about the treatment plan that I want to propose to my patient. Once I tap on Generate Smile, a smile simulation automatically appears over the patient's teeth. So in the smile simulation, I can show my patient different possibilities right on that first consultation. The smile simulation should be done in the first consultation, as I'm saying. And the reason why, it's because it's fast and it has some limitations when it comes to a clinical workflow. When we are doing a smile simulation, we are showing a simulation from a frontal view. But here, I don't know anything about occlusion. I don't know anything about proportions, but I can see the aesthetics of the final outcome. There are many other options into the software here, but the one that I want to show you now is the one that gives the patient different options on different teeth shapes, so they can try on different smiles digitally first. Once my patient understands that rather than doing just those two laterals, I can also perform an entire workflow, a more beautiful, more harmonic smile for her, I can then move on to the next step. And that's what happened to this patient. So just to summarize, an AI smile simulation. In Smilefy, the AI smile simulation is powered by the artificial intelligence. So it's fast and it can be done chair side. And the main goal here is to motivate, educate, and to better develop my treatment plan. And then, of course, upsell your treatments. When showing these smile simulation to your patient, you can do the way that I'm doing here. I like to have my iPad next to me, and I also like to place the before and after on a big screen, so that way I can fully educate my patient in the different options. And now that my patient is more into knowing about a different treatment option, I can go ahead and add an intraoral scan into my design. In certain cases, you will need to also add a CT scan. It is not mandatory, but if you are planning a gingivectomy case that involves some bone removal, like in this case, for example, then a CT scan is highly recommended. The CT scan can be converted into an STL file or in a bone file, and I'll show you. And you can perform your perio analysis and create your mock-up trial all together using the software. So the patient is very keen to do the treatment plan. Let's move on to our inter-appointment. It's when you create the 3D plan. When you create a 3D plan, just to summarize, you cannot use the smile simulation because the smile simulation, it's just a simulation or a draft that is placed over a patient's picture. For you to deliver the 3D walks-up, then you would need a 3D smile frame, which is also available on Smilefy. So you will add your patient's photographs and your patient's intraoral scan. For her, I decided to do two types of dental wax-ups. One of them is the composite veneers restoration that she came in for, with no prep, with no gum contouring. The other one would be a gingivectomy plus veneers, because I wanted to show my patient the other treatment plan that I proposed. Once you add all these files into Smilefy, you will simply tap on 3 points on your intraoral scans and 3 points on the picture, and the files will automatically be calibrated together. The second step, you will set the Smile frame and select the 3D design and start to create your digital wax-up. Then you export your wax-up and you are done with your first mock-up. Then to create a second wax-up, instead of initiating it from scratch, you simply open that same 3D design, make the adjustments, and export the second 3D wax-up file. So here, I'm going to now open my Smilefy iPad version. And here, as you can see, the layout of the software is very simple and very intuitive. We have here all the patient's files all together. We have the Smile simulation, which I already created, all next to each other. And then I have the 3D designs. So I'm going to open the 3D design. For you to see how you can also perform your own 3D wax-up trials in your office or wherever you are. Since you are using an iPad or a MacBook, you can do it from everywhere. Before I start my 3D wax-up, I have a question for you, and I would like you to answer. You can simply tap in one of these answers. Do you design your own dental wax-up trials? Okay, so I see here 70% of you guys don't perform your dental wax-up trials yet. 33% of you guys do perform your wax-up trials. That's great. All right, so I'm going to show you how you can do it, and it's quite simple. Here, the files are already calibrated due to time, but like I showed you before, you set 3 points and they will merge together. The second step is for you to adjust the position of each tooth. And that's very simple. You can simply group them all together and move them around. As you can see here, I'm either bringing a more lingual more buccal, mesial, distal. For this case, what I was doing, I was creating a digital wax-ups for composite veneers only. Okay, so here, as you can see, the design itself, it's pretty close to the gingival margin of the patient's existing conditions. So it is literally a smile enhancement. Okay, you can select on different teeth shapes. Notice that as I'm tapping on the 3D teeth library, the teeth automatically changes in the arch. So imagine you communicating with a dental technician, how long it takes for you to ask them just to change one tooth or two teeth. Here, you can do it all yourself. Let me simulate this smile so you can see it. And try on different teeth shape just by clicking in the teeth library. I can also tap on the tooth itself to preview the 3D teeth that I am looking for. And before, I was talking to you that as my simulation, it's a design where you only see it from a frontal view. So that's why it has a lot of limitations. On a 3D design, besides being facially guided, you also visualize the 3D wax-up from different views. So here, I have on my top left corner, the frontal view with my patient's picture. The top right corner, I have, let's say it's like a 45 angle degree. So that way you can visualize if the tooth is too buccal or too lingual. And if it is, for example, you can always make any modifications as I'm doing here right now. You can visualize it from a profile view as well. So here I'm doing here on the bottom left corner. I'm doing this live on my iPad version, okay? But you can design it on your Mac version as well. On the iPhone version, you can also do it, but the screen is just too small. But if you desire to do your 3D wax up on your phone, that's something that you can also perform. Notice that I have here, in this case, I also have my CT scan, but that's due to her conditions. You don't necessarily need to have a CT scan involved into your wax-ups. You can do it just with a photo and an intraoral scan. So by having different views, I can check if the teeth design are overlapping each other, if the contact points are in the right position by showing just the outlines of these 3D designs. And by simulating the 3D wax-up in my patient's face, I can check on details. And this is the reason why we go back now to that picture taking. If my patients, if I took a wrong picture of my patient, I would probably create a smile design with the wrong smile curvature with the wrong teeth proportions. And since I have the right picture, I can adjust the teeth design accordingly. I can bring my lateral more coronal, more apical. I can rotate it. So take a look at her existing condition, for example. She's a young patient, her teeth are too short, but respecting the patient's initial desires, I am creating here a non-prep smile enhancement for her. Notice that the mock-up here are not touching, it's not going over the patient's existing gums. So it's totally additive. Looking here, we have the upper and lower occluding. So I have here proper spacing. Here's the palatal area, the canines, they're touching it all properly. Of course, once I print it, if that becomes my final restoration, I'll always do final adjustments in mouth. Then my next step is to simply tap on what we call a mesh editor. Just to make sure that every detail of my wax up is going well. Look at this. This is fantastic because you can literally create your wax ups using your phone, your iPad. So usually what I do, let's say if I have like 3, 4, 5 new consultations, I collect all of the patient's files all together, and then either by the end of the day or on another day, on a Saturday or so on, I spend about like 20, 25 minutes with each patient, and then I create all wax-ups all at the same time. Then on the following week, the patient can come in and all of them can perform these smile trials. I can guarantee you that these type of workflows allows you to win more patients. It gives the patient the sense of being in the right place, of being heard, of knowing what's happening with their smile prior to initiating the treatment. And then for me as a clinician, this becomes a great tool because I can literally treatment plan the cases using the software. I can better communicate with my lab if I have to mill some veneers, for example, if I have to do anything further than just the designs that I'm doing here. So here I have my first wax up. Right here at the bottom of your screen, you will see export model. So once you tap on export model, you will be able to export the first design. Then, and that's the coolest part of it, once you export the first wax up, you can simply go back into that same design and then create or adjust the first design into a second design. So here, all I have to do is to tap on group. I'm going to now create my second wax up trial, which involves the patient's soft tissues as well. Notice that if I reduce the opacity of my intraoral scan, I will be able to visualize the patient's bone crest. Notice that the patient has a huge biological space in there. She did ortho in the past. So absolutely, I can work on a flapless technique on these anterior teeth. Then for the posterior region, I would have to do an open flap as I don't have enough space of the biological space. So if you take a look at the dental wax-up, how intuitive everything is. I can now turn this file to the side. See what I'm doing? I'm just making small adjustments. Here I'm doing the design over the bone file. If I bring the opacity back, notice that I will now I'll have to bring my mock-up more buccal, so that way the mock-up is going over my patient's existing gum. So then when I perform this myo trial, the patient can see it. So here, the same thing. Again, if you are planning this type of procedures that involves gingivectomy with bone reduction, in that case, a CT scan will really help you on performing a more conservative outcome. If you don't have a CT scan, or if you don't know a lab that could do the CT scan for you, there is no problem. You can still perform this type of procedure by doing an analog perianalysis by probing the patient and then taking the notes of taking the measurements of the notes and then apply these measurements into Smilefy. Here, for example, I have, let's see. So this is absolutely possible. We have 4.46 millimeters between the bone crest and the new cervical margin of the future restorations that I'm proposing. When it comes here to the premolars, then it gets a little more complex. That's why we have to do an open flap. But here, we would have to do also probably like a 1 millimeters of bone reduction to have a proper biological space. So as you are designing this mock-up for a patient, you are already treatment planning the entire workflow so you can proceed. Let's say the patient came in and she has time to perform the whole procedure. You can also get ready. If she's ready, you are ready, and you can follow up and already initiate the treatment right on the second visit. Then the following steps is the same. You tap on next and you export the file. So exporting the files. So exporting the files, you will 3D print your dental wax-ups and create your silicone keys. Okay, so that's important. And that's something that you can do it, your assistant can do it. So that way you have everything ready for that second consultation. Notice that both wax-ups that were created on Smilefy are already wax-ups. They are not only for the patient to try on, but they are also wax-ups that can actually be performed in a dental procedure, either for the composite veneers or for the gingivectomy procedures plus the veneers as well. On the second appointment, let's now talk about the second appointment. But before we do the second appointment, I have a question for you guys. What is your specialty? And do you have experience performing dental wax-ups in your practice? Okay, so here I see that 80% of you guys are general dentists. Then I have 7% of prosthodontists. And then we have 13% of collaborators, a dental assistant, a hygienist, or other. That's very nice. So on the second appointment, since we have here dental hygienist, we have other collaborators as well. This is something that you could also help the doctor performing, which is the silicone guide and even helping them on this mock-up trial experience. On the second appointment, patient come in. You will be setting up your patient. You just apply some bisacryl into the silicone index. Notice that the silicone index that I created, I cut right close to the gingival embrasures. So that way it's much simpler for you to remove all the excess. Okay, so right before the bisacryl sets, apply some air over that area on the close to the gingiva, and then just remove the excess with some cotton pliers. To remove that wax up that you created, first, release the buccal part of it, then pull it all downward. Look at the mock-up that was designed on Smilefy. Get a gauze with alcohol 70%. That way you will give that shine right off the bat. You don't have to polish it too much. And then, of course, remove all the excess. If there is any excess on the occlusal area, remove it. You can remove it with a explorer. So that's a close-up of the wax-up. Notice that I cut the model as close as possible to the design, so that way all the excess could be removed in a much simpler way. After small adjustments, the patient was able to occlude without any problems. And then I took some pictures and videos of that patient. So this one is the one with the gingivectomy. So that's the option one. Now, let's move on to the second option. Here, as you can see, just so you guys could see it, there are two walks-ups. One is with the gingival periodontal procedure. The other one is without it. So after taking some pictures of the patient, you quickly remove the walks-up trial. As you can see, it pops out very easily. You don't apply any etch or any bonding into it. You simply dry everything out and then apply the wax-up trial into it. And then to remove it, very quick. Just use a cotton plier and everything will be popped out. Now that the patient's teeth are clean, ask your assistant to give you the second wax-up trial, add the bisacryl in it, then repeat the same procedure, remove the excess, then to remove it, first release the buccal part of it, and then put it all down. If needed, in this case, I actually had to do it for some reason, you can also apply some shofu polishing paste with a cotton fluffy wheel, and that will shine the entire wax up. So that's the fluffy wheel, and that's the composite polishing paste. The entire consultation took no longer than 30 minutes. Here, I respected the patient's desires by creating the wax-up trial option 1, which was just to do a smile enhancement. Here, I added from second premolar to second premolar. And then I also created the second version, which is the version that I felt was the best for her, which would involve gingivectomy and veneers, and then from second premolars to second premolar. This case was done about a week ago, and the patient, even though she came in for a treatment that relates to the wax-up trial option 1, the patient now ended up closing the option 2. What does it mean for your patient? The patient now, it's much more confident into the procedure that she's going to go through. For your office, now the office becomes much more profitable because you get a much more complete workflow with just one patient. So instead of running after 15 patients, you can do a complete workflow with that one patient because the patient trusts you, and then she can literally see the benefits of doing a more complete treatment rather than just doing what she came in for. And for a personal perspective, you as a dentist, you feel that you are literally doing the right thing. So this is what Smilefy workflow can do in your practice. You simulate the patient's smile. You can 3D plan these cases using simple files, calibrating them together, and selecting different teeth shapes while reflecting that design into a digital patient to 3D print multiple walks-ups, and perform walks-up trials that will give the patient best outcome possible for that treatment. So I have here a final question to you guys, and I would like you guys to answer. Do you find implementing these digital workflows into your practice beneficial? Wonderful. I'm seeing here. So 64% of you guys are like, yes, absolutely. 7% are yes, sign me up. 29% is yes, I want to know more about it. I mean, digital workflow is here to stay, and it is changing the way we do and we perform dentistry. If we keep doing what we are accustomed to do, we will be just doing the regular dentistry that we already know. Jumping into a new world, on a new experience, giving your patient a better experience and yourself a better experience by knowing exactly how to treatment plan your patient, it is literally priceless. But it takes you're willing to learn different workflows. So that's the reason I want to present you guys that we have courses around the world and also online interactive courses. We have run hundreds of courses already, and we have thousands of doctors already doing this type of workflow in their practices, and the feedback has been amazing because now the doctors have that sense of doing something right, of running for the best treatment possible to the patients. So in our online course, which is available in every country, we have our online Smile Designer certification course. This course is based on 3 modules where we have live Q&A sessions, personal feedback on your Smile designs. So we highly recommend you to use a real case, not just one of our cases for you to practice, so that by the time you finish the course, you can have your own mock-ups, you can have your own simulations, and you can deliver your own treatment plans. If you're in the United States, it gives you 21 CE credits, and it starts on May 20th. Okay, and as a thank you, because we have 125 doctors here registered, for you until May 1st, we will give you $300 discount in every online or in-person course. Okay, so all courses, they include the membership of the softwares, so that way you can use it on your iPad, iPhone, or MacBook. We also have the in-person courses for those who can travel, for those who are around. If you are in Europe, May 6th and 7th, we still have 3 seats for the in-person online Smile Designer certification course. It's full hands-on, just a little lecture, just so you can follow the entire structure. But the focus is to make you a Smile Designer. Learn how to take the pictures, learn how to treatment plan using this digital workflow, learn how to create the 3D walk-ups, and how to perform the mock-up trials for composites or for any other type of treatments. If you are in the United States, Canada, South America, or want to travel to United States, June 24th and 25th, and also July 22nd and 23rd, we will have 2 courses, one in Los Angeles and one in Miami. All these courses, I will be there along with our team to teach you everything from the beginning to the end, so you can master Smile designs and this type of clinical workflows. For those who perform anterior composite restorations and outsource your wax-up trials, your diagnostic wax-ups, We also have the online anterior composite veneers course, which we will start on June 9th. The course will take you from the digital workflow of it to selecting the right material for your composite restoration, selecting the right patient for your composite restoration, to deliver the technique using these models as a base for your wax up. And if you want to come into our in-person, hands-on anterior composite restoration, we have June 17th and 18th in Miami, which is already sold out, but we have a July 29th and July 30th, which will be held in Miami, perfect place for you to vacation as well, which we will do everything from the digital workflow, and we will actually have a hands-on on the composites that you designed on Smilefy. So that way, once you go into your office, you can go from the beginning to the end, confident that you can perform the entire workflow for composite restorations. So here we have a $300 US. Samia is the contact of information. She is right here in the chat, and she can give you the right link and the right information about all these courses. Okay. We also have the membership, but these courses, this webinar specifically was focused on all of our courses that we have. That's why I went a little bit in depth into the 3D design, so that you can have a better sense on how rich these courses are and how beneficial they can be to your practice. So before we finish our webinar here today, I can open now for any questions. So we have here the chat. If there is any question, please ask a question here in the chat. And if not, Samia will be here for the next 5 to 10 minutes to answer all of your questions, to help you signing up. These are limited courses, limited seat courses, and we'll be very happy to have you in one of our events.